The first Ebola outbreak was described in the Democratic Republic of Congo, formerly known as Zaire, and in Sudan in 1976. Since then, more than 20 outbreaks of Ebola have been documented in Africa, especially in Congo, Sudan and Uganda, with an average fatality rate above 50%. There have been around 6,000 deaths by Ebola worldwide since the 1970s. In contrast, more than 1,700 people die from malaria and more than 2,000 children younger than 5 years of age die from diarrheal diseases every day. The incubation period for Ebola is between 2 and 21 days. The first symptoms are fever, muscle aches, fatigue, loss of appetite, nausea and vomiting. A skin rash may appear after 1 week and liver and kidney problems a few days later. Only 30 to 50% of cases develop bleeding in the gut and lungs. Around 40% of patients recover and heal completely, the rest die. When symptoms are not present, the probability of transmission is minimal. During the first days, the viral load is very low and the probability of infecting other people is very small. As the disease progresses, the amount of virus increases and so does the probability of transmitting the infection. The virus is transmitted from person to person through direct contact with the body or body fluids of an infected person, blood, urine, sweat, semen, feces, vomit or maternal milk. Infection can also result if contaminated objects from a patient, such as clothes, syringes or needles, come into contact with mucous membranes, eyes, mouth or skin abrasions. The virus can also be transmitted by infected animals. Ebola virus is not a respiratory virus and is not transmitted through the air. It is not a gastrointestinal virus either, so it is not generally transmitted via water or food. There is no evidence that Ebola virus is transmitted by mosquitoes or any other insect. The transmission rate of Ebola virus is very low compared to other viruses such as SARS, HIV, mumps, smallpox or measles. Therefore, the probability that you become infected if you have not been in direct contact with a patient is negligible. The probability that Ebola spreads throughout the planet and becomes a pandemic, causing hundreds of thousands or millions of deaths, is minimal. We live in a global world and it cannot be ruled out that more cases will appear outside Africa, but Ebola cannot be considered a pandemic.